Welcome. Welcome, welcome, welcome. we, we want to get started here and welcome all of you to Naples United Church of Christ. I'm Bob Nordland, a member here and also a member on the task force for Aging Well. And this started in 2016 when a number of members got together trying to address the issue of aging, and various issues came along like financial, cyber attacks, how to plan for end-of-life decision-making. But also at the time we had a lot of medical topics that people wanted. So at that time I was lucky enough to be able to go over to the NCH people here and dig up some speakers. And now it's much more formal, and it's a wonderful program that we can work together as co-sponsors of this program. And we're very, very pleased to have you. We're also co-sponsoring with the Alzheimer's Support Association, and they just had a talk just earlier this week and so on. So we're trying to keep up with things that people want to hear about, and this is certainly one of those that we do. So basically, I just wanted to introduce, we have Dr. Carlos Quintero, and a wonderful panel here, and I'm going to let him take over, and thank you very much. There'll be time for questions later on. It will pass mics and so on, but let's get started then. Thank you very much.
Great. Thank you, Bob. I just want to make sure the speaker works, so I think you guys can hear me okay. I can hear myself. Welcome, everybody. So thank you for joining us for this exciting discussion on longevity. Great crowd today, so we're hoping to have some great conversations here a little bit about longevity with our experts that I'm going to introduce in a minute. So about NCH, I think many of you know we're transforming from Naples Community Hospital to Naples Comprehensive Health. So we're growing. I think a lot of you all have seen the growth, done some great work with our new leaders, our new CEO, or that's been CEO for the last few years, but we're partnering with the best. We've got partnerships now with HSS from New York, which is the top orthopedics hospital in the country. As many of you know, we have residency programs as well and some fellowships. We have endowed chairs. We have a fantastic simulation center. And recently we were named one of the top 50 hospitals in the country. So we're actually doing great things thanks to a lot of the speakers that are here with me today, plus the entire staff. So thank you all for that. So at NCH, we're proud to be a hospital built by the community and for the community. So we definitely want to give back and give you guys some time and give you guys the opportunity to ask us some questions. It's our mission to bring expert care and knowledge directly to you. So hopefully this will be very informative. I did want to introduce our panelists. I'm honored to be joined on stage by Dr. Gary Swain, who is concierge physician and former president of Collier County Medical Society. I don't know if Gary, if you want to say a few other words about yourself, maybe how long you've been here or what else you do, what else you like to do with your time off?
I'm a board-certified family physician who has been living in Naples since 2013. Started off with a regular practice and kind of moved concierge about 3 or 4 years ago. I'm board-certified traditionally in family medicine, did a long faculty stint teaching medicine, and then eventually went back to do a fellowship in both academic medicine as well as functional medicine. So that's what I basically do now, so I'll turn it over to you.
Thanks, Gary. Dr. Carl Oringer, Director of Preventative Cardiology Program at NCH Rooney Heart Institute. So I'll let him say a few other words.
First of all, it's great to see you all today, and this is a tremendous group. We're excited about talking to you about what is new in terms of prevention of cardiovascular disease, and that includes prevention of heart attack, stroke, and leg artery blockage that can lead to amputation. And we're very excited about new approaches that we can take to keep everyone well. And it's not just maximizing longevity, which we do, by the way, but it also is what we can do when you get into trouble to improve the quality of your life. So I'm really excited to be with you. I've had a long academic career in cardiology and have also been very involved with national organizations and writing the guidelines that our doctors use to treat high cholesterol in the United States. So it's a pleasure to be with you today.
Thank you, Carl. And Dr. David Backstein, Medical Director of HSS at NCH.
Thanks, Carlos, and thanks for having me here today. My background is orthopedic surgery. My fellowship was in hip and knee replacement. That's been my focus and really for the past 15 years, even more just focused on knee replacement and redo of hip and knee replacements that have failed or need to be redone for one reason or another. And indirectly, I think orthopedics is a big contributor to longevity, and I look forward to discussing it.
Thank you, David. And then a little bit about myself. I'm a hospitalist by training, so if you've been in the hospital, you may know what a hospitalist is. I'm internal medicine trained. I work seeing patients in the hospital, plus my other administrative roles. I work with all of these physicians taking care of patients as well as the rest of the staff. I've been here 18 years, quite a long time, and I really enjoy everything that has to do with inpatient, hospital, patient experience, quality, operations in the hospital. So very, very happy to be here. Thanks. So I wanted to kick us off here. First question, what we're going to do is we're going to pose some questions to the team here, and then at the end we'll have about 15 or 20 minutes where you guys can bring up some questions as well. Just want to let you all know. So first topic we wanted to talk about was how do lifestyle factors contribute to both cognitive and cardiovascular health, and what role does early intervention play in longevity?
So I distinctly heard that question was directed to me. So what I think I'm going to do is, first of all, tell you that it is really not particularly complicated to know what to do to live a long and healthy life. The first thing is, if you want to live a long life, it's nice to have some good genetics. And we really don't have the ability to change that. But because we all have certain genetic longevity built into us, we would like to do what we can to maximize the quality around that longevity. And based upon a number of the treatments that we use today for prevention, we actually can increase the duration of life significantly. People who used to be felt to have serious heart troubles that you knew they were going downhill quickly now live for long periods of time. We take patients who have heart failure and we can turn that course around so that they live much better lives and longer lives. Patients who want to protect themselves from that first event, we know what to do, and usually that revolves around, first of all, the fuels you put into your body. So we like to think about the Mediterranean diet as a great place to start. So that's whole grains as the basis of that. You'd like to use fresh vegetables, legumes, low-fat dairy products, and fish, olive oil, and then minimize meats, particularly processed meats, sweets of all types, candies, cookies, taking away all the great things. Doc, what are you trying to do to me? But it's not to say you can't ever have those things. It's just getting a focus on balance, and balance is everything that really tells you what you need to do to be successful. Exercise is such an important part of that, and regular aerobic and musculoskeletal exercise. And for maintenance, we usually like to think of 150 minutes a week, 150. So that would be 30 minutes 5 days a week, and if you want to do more, that's fine. You don't have to get into the high-intensity stuff, because in fact, the older we get, the more likely we are to get injured when we try to get into high-intensity exercise. So moderate intensity exercise is terrific. And then you need to keep your brain active. So you need to be thinking of things that are going to keep you mentally active. You got to read, you got to attend lectures, you got to listen to podcasts, whatever it takes to keep that brain going. It's going to really help you age in a more effective way. And finally, all of us have medical issues that we get to. And so when that happens, you really need to be careful to choose a physician who is up to date, someone who knows the latest treatments, has a lot of clinical experience, and people really need to relate to their doctor. But remember, sometimes you have a nice doctor who doesn't know anything. So you've got to make sure that not only do you have a physician who is up to date, somebody who knows the current treatments, but also someone who maintains their ties to learning and teaching others about the most important things in their specialty.
Thank you, Carl. What about on the orthopedics world? Diet, exercise, how does that influence how we take care of our joints before they get to you, Dr. Baxine, and having a knee replacement or a hip replacement? Does the same apply for joints, and what can the community and our patients do to try to help prolong the life of our joints?
Like the most common form of arthritis is osteoarthritis. It's, for the most part, probably genetically programmed to happen. You certainly can maintain joint health by keeping mobility, joint muscle strength. There's no real evidence that any of the preventive measures like glucosamine or any of the medications you might buy at Costco are going to prolong your joint health. Certainly, we see people that are both former athletes that get osteoarthritis of their hips and knees, but we also see plenty of people who have obesity and don't really have never had a very active lifestyle. So it's not, I hear all the time, I used to be a marathon runner, that's how I got osteoarthritis. Well, it's probably not completely true unless you have a distinct injury like a meniscal tear, a fracture. For the most part, people get arthritis because of just wear and tear and pre-programming for their cartilage cells to die over time. And cartilage cells don't regenerate, they're like brain tissue. Once they're gone, they're gone. So, I mean, I think for the most part, we know that obesity can contribute to joint pain, and one of the first non-operative measures for someone who has osteoarthritis of the knee or hip is an instruction to try and lose weight. Oftentimes, I recognize that that's easier said than done. Most people will have lost weight if they have a weight problem before they turn, 70 or 75. So, it's an option. It's certainly beneficial for many reasons, not just your joints, but it's probably not going to be the ultimate solution. But by the treatment methods we have, we can then contribute to these other factors that can help you live longer. So if you have a very painful arthritic joint, you're probably not walking, the 30, 50 minutes a day. If we can get rid of that pain, you can get back to being active and maintain your heart and your brain and so on. It has chronic pain has a negative impact on inflammation, on your mental, happiness level, and we all know that has a role to play. So getting rid of the pain probably helps in that regard as well. So I think for most of the joint replacement operations for osteoarthritis, there's not a lot we can do to prevent it, but once you've got the problem, we have very good solutions that can then indirectly help with longevity.
So before getting to Dr. Swain, really quick question. You do a lot of surgeries for joints.
Yeah.
How important is it for our patients, and many of which may be here, before they go for the surgery, how important is it for them to be on the right diet and doing exercise before their surgeries? Does that help in outcomes?
No, there's no question. We know this better now than ever, that preoperative nutrition has an impact on wound healing, recovery time. There's an entire industry now of preoperative supplementation, where these companies will send you a box full of stuff for you to eat before and after the operation, because it's making sure you're getting those basic nutrients, protein that you need for wound healing and for recovery. So there's no question around the time of surgery, nutrition has a factor. More and more, we're also learning that a lot of complications like joint replacement infections that can happen years after surgery until now, we would often think, well, they must have had a tooth that was decayed or a urinary tract infection. Oftentimes the patients would deny having that, and more we're realizing it does have to do with nutrition, something called leaky gut, where if you have the right bacteria in your gut, bacteria can escape, get into your bloodstream, and then seed out to your joint replacement. So there's no question that around the time of surgery, nutrition is important, and even further down the road, it probably can help prevent complications.
Thank you. So talking a little bit about brain, we've talked about heart, we've talked about joints. Gary, any thoughts on lifestyle changes that may help us stay sharp into our 90s and 100s?
You may have noticed that Dr. Quintero asked that first question of me, and Dr. Oringer stole it. Did you see that? And he stole it because he knew that he and I are going to say roughly the same thing. So it'll look like I'm copying him. But we know from several studies in Finland called the finger studies that are now being done in 39 other countries that we can delay or reduce the decline in Alzheimer's through certain lifestyle changes. Now, we're constantly coming up with new meds. We've got 2 new meds recently in the last 2 years that we use to dissolve beta amyloid in the brain. But even that has serious complications, because a lot of these drugs will have a risk of causing brain bleeds up to 30%. And the reduction that you get is a 30% decline, not an improvement. And so there was a doctor that was a functional medicine doctor. He was a neurologist who took his patients and started doing functional medicine training with them. And he wanted to do a big study on this, but the problem was he had 39 different variables that he wanted to test in his study, and the institutional review board said, no, that's too much. You'll not be able to, you can't power it strong enough to make